Whenever we have an implant placed in the anterior region, we generally need to come up with some sort of an option for a temporary for the patient. So the typical options that most of us are using are either an Essex retainer or a stay plate or a flipper. These are really options that generally our patients absolutely hate. So another option would be doing a one-wing Maryland bridge. So the way I typically do this is before we do surgery on the patient, we will image the area with the edentulous space. And then from here, my assistant is just going to typically take over. She'll draw a margin on one of the adjacent teeth, just generally around the cingulum area, and we'll design a one-wing Maryland bridge. Now, setting this up in administration, we're going to choose a bridge for this type of restoration, and then our retainer tooth is going to be a veneer and then a pontic. Now, when you do select a bridge, we don't have the option for using one of the hybrid blocks, and those are generally my favorite materials. I'd rather use a composite material for my temporary, for my one-wing Maryland bridge. So in order to do that, we're going to trick the software. We're going to call it Emax, and then we're going to either place in a Serasmart block from GC or Ivoclar's Tetric CAD. Those blocks are the exact same size as Emax, so the software is going to think that it's Emax when it's milling it, but you'll be able to mill this type of restoration out of that block. So from here in about 7 to 8 minutes, we're going to be able to mill out our restoration, and we've got our pontic with a wing attached. And then we're going to do surgery on our patient while that's milling and being fabricated. We can do our imaging if we choose at the time of surgery, and then our patient's going to be able to walk out with something that is permanently bonded into place. It's composite, it can be easily removed after when we're ready to restore the restoration. And with this type of a restoration, we don't have to worry about the patient putting too much pressure on the surgical site, and our patient doesn't need to worry about something that comes in and out of the mouth.